So with that, we're going to start the recording. Thank you all for joining us for today's webinar, Getting Organized. I am Monica Bryant, the co-founder and chief operating officer for Triage Cancer. I am also a self-proclaimed organizing fanatic, which is why I think I was tasked with providing this webinar today. Now, everywhere you look, it seems like there's advice about how to declutter and get organized. In fact, people have made millions trying to help people get organized. But when we really stop and think about it, these tend to be somewhat generic tips and tricks. And it really got me thinking, do things change? Do recommendations change around getting organized after someone's been diagnosed with a serious medical diagnosis? Are there different strategies that are needed? And I sort of landed on the idea that the answer is yes, that it's not just about being organized or having pretty drawers or closets or your books in some sort of color-coded way, but that there are really functional, necessary steps people need to take once there's been a diagnosis like cancer. And I was thinking about this, if organizing is hard for everybody, because literally if you type, getting organized into Google, you get 500 million hits back. And there are so many resources out there. Why did we think it was necessary to do this webinar? And I landed on a couple of reasons. So the first is that none of the existing resources talked about organizing in a holistic way. So I found resources on organizing your finances or your spaces or your schedules, but nothing that we found really addressed that people might be coming to this challenge of organizing from a place where they're not 100% themselves. So they could be struggling physically as a result of the cancer or the side effects. Certainly, there is a stress and anxiety component to being diagnosed and going through treatment that can make something like what would otherwise be considered an everyday task harder. People are already dealing with a full plate. So life is busy. Then there's a cancer diagnosis. Now there's all these other things you need to think about. And on top of all of that, we're asking people to be organized. It's too much, it becomes information overload. But then there's also this extra piece that sometimes gets forgotten, that there might be a true side effect that is causing it to be challenging to get organized or to stay organized. And by that, I mean this term chemo brain. This term's a little bit of a misnomer, but it describes the cognitive challenges that people may experience after cancer treatment. And those challenges could certainly be challenges with short-term memory or an inability to concentrate or trouble focusing. Maybe it's challenges with executive function or learning new things or working with numbers. The reason I say that it's a little bit of a misnomer is that we know that these issues don't just arise as a result of receiving chemotherapy, but that other types of treatment like radiation therapy or endocrine therapy can also cause these cognitive challenges as well. So certainly if you're experiencing any of these challenges and you haven't spoken with your healthcare team about it already, I would strongly encourage you to do so. But I also brought it up because I want to recognize and acknowledge that if organizing or being organized was something that you felt like you were good at prior to your cancer diagnosis, and now you're struggling, there could be a lot of reasons for that. So when I started thinking about organizing and why it was so important to be organized, I came up with a couple of reasons. So I think ultimately there are reasons around you need to be able to get what you need and get the help that you need. And sometimes in order to do that, you've got to get organized. There have also been tons of studies showing that being organized and decreasing clutter, and I use clutter in quotation marks because that could mean a lot of things to different people, decreases your stress And that decrease in stress actually has physical health benefits to it. So decreases in stress help support your immune system, which of course is going to be important overall in the midst of cancer treatment. I think it's also emotionally helpful in that at a time when so many people feel out of control, they don't have control over maybe what treatments are available to them, or certainly what the tumor is doing. That getting organized is a tangible way to regain some control and to hopefully empower individuals. We're going to talk about the financial reasons why people need to be organized and how there are some reasons around protecting your loved ones. Now, when we talk about getting organized, I also came up with the idea that, well, there's lots of different places or buckets of organization that people need to think about. And these were just some that I came up with to be a starting point for us in our conversation. But of course, none of this is a one-size-fits-all situation. And I recognize that everybody is coming on today from a different place. So maybe you're someone who's in the middle of treatment and you're really just trying to stay above water. Maybe you're not in active treatment anymore and you're trying to get back on track. Maybe you're a healthcare professional that came for the free CEs. Just kidding. You're likely coming to get tips to help your patients, right? So what are things, tangible, practical things that you can pass on to be helpful for your patients? I also want to acknowledge that I realize some of these suggestions that I'm going to give today aren't going to resonate with everyone. So maybe it's not going to resonate because the suggestion has a cost associated with it that isn't feasible right now for you. Or maybe I'm going to suggest technology that you might not feel comfortable using. So I'm going to do my best to give multiple solutions and suggestions in different places, and hopefully you'll be able to walk away today with something that resonates. Now, I recently had to explain to my young children that when I was a child, there was only one day a week that you could watch cartoons, and that video calls, the idea of, what we call FaceTiming now, that was only something you ever saw in like sci-fi shows. So I say all of that to, say that I completely understand that some people don't feel as comfortable with technology as others. I also recognize that there is a digital divide in terms of access in this country, and I don't have a solution for that today. However, for those that do have access to even a minimal level of technology, there are some really useful tools when it comes to organizing. So email, electronic file storage, sometimes also referred to as the cloud, shared calendars, for example, all of those things can be really, really helpful. And signing up for some of those things is even free. And so these are just two examples where you can access free accounts. So you can sign up for a Google account for free. And that Google account will give you access to things like email and file storage. Apple is another example, but this is not an exclusive list at all. Now, if nothing else, I think it is very important in the year 2023 for everyone to have at least an email address. And it's not just because emails become the primary way that people communicate across distances, but there's also multiple tools now that are only available if someone has an email address. So for example, many hospital systems have patient portals. And so the fastest way to get a response from a provider is to get on that patient portal using your email to log in and ask a question. If you call and leave a message, I'm sure you'll get a response, but the question is, when will you get that response? The Social Security Administration, if you want to sign up for an account to be able to see your Social Security earnings, you need an email address. And it used to be that everyone was sent those earnings statement once a year in the mail. And that's not the case anymore for everyone. And so there are some real tangible benefits to taking the extra step to signing up for email. And you can do so using these free tools. I struggle a little bit because while the actual email account might be free, there are, of course, other costs associated with accessing email. So the device itself that you're going to use, so whether that's a computer or a tablet or a smartphone, that has a cost associated. And then there's a monthly fee typically. So you have to have service for that phone to access, or you have to have Wi-Fi in order to access the internet. So I do recognize that even though the email account is free, there are some added costs that could be barriers. Some solutions to that, if cost is a challenge, is to think about where you might be able to access the internet or computers for free. So most public libraries have some sort of computer that you can use. Maybe you have a friend or a neighbor that will let you use their device. Community centers often have computers. A religious center, a mosque or a synagogue or a church, maybe there's a computer lab. There are some cancer community centers that can offer computer assistance. I know, for example, some Hope Lodges or Cancer Support Community, Gilda's clubs have computers that are accessible to people. But then there are also some other programs out there where you may be able to acquire the device or acquire the service needed either at a discounted rate or for free. So Goodwill has a program where they recycle computers. The Lifeline Assistance Program is a federal program to provide phones with a certain amount of data and minutes on, accessible via those phones for individuals who are seniors and have low incomes. The Affordable Connectivity Program provides free or low cost internet access at somebody's home. There's a ton of local nonprofits, and I know we're from all over the place, so it does depend on where you are physically. But the point here is to know that there are some solutions to the cost associated with accessing email or the internet. So while I'm certainly a proponent of someone having an email address, there are a few downsides to that. And junk mail is definitely one of those downsides. And if somebody's already feeling overwhelmed and that there's too much clutter and they're missing things, getting 100 and 150 junk mail emails in your inbox every day just adds to that. So there's a couple of strategies to deal with that. There's a service called unroll.me where it actually, you sign up and then it looks through your inbox for digital newsletters and other types of emails that maybe historically you haven't really been opening, you've just been deleting. And then it gives you a really simple way to pick which ones you want to stay on and which ones you want to get rid of. So instead of having to go through your inbox and hit unsubscribe for each one, it's a faster process. I also know some people who maybe have 2 Gmail addresses. And so there's one email address that you use, like when you go to the Gap and you sign up for their loyalty program, or you're signing up for a newsletter that you may or may not actually want to read. And then there's another email address that's only used for things like your doctor portal, the Social Security Administration bills that are going to be sent, close family and friends, so that if you are feeling totally overwhelmed, you don't even log into that other email address. You're just logging into the sort of important things one. So 2 strategies there for email. Now, we also have a problem with junk snail mail. I am often shocked at how much mail I get that goes directly into the recycling bin. So if you are feeling similarly, there aren't as easy a solutions as with email, but there is a website called the Direct Marketing Association's consumer website. And if you log onto this website, you can opt out of things like catalogs and credit card offers and insurance offers, where those companies are typically buying a list of mailing addresses and then sending it out in that way. There is a small cost, so you do have to pay $4 to opt out of this, but then that opt-out lasts for 10 years. But let's say you don't do that, or you do that and you're still getting lots in your mailbox. I tend to think that mail is an ongoing source of stress for most Americans. The number of blogs about how to deal with your mail is sort of shocking. So a strategy that I think is incredibly valuable is the never put it down strategy. So it works like this. You walk to your mailbox, you get the mail, you walk over to where your trash can is or your recycling bin is. And then as you stand there or sit there, anytime you look at a piece of mail, you decide keep or trash. If it's trash, it goes straight in the trash. If it's keep, you go another round through, you open it up, and then anything extra that's in there. So is there an extra, blurb for something in there that you don't need? Throw it away. Is there a return address envelope in there, but you're going to pay your bill online, so you're never going to use that envelope? Throw it away. So that at the end of it, in hopefully less than 5 minutes, you now only have a few pieces of mail that you know exactly what to do with. So what do you do with it then? Well, I think it depends. I think it's helpful to have categories. So I think having a spot in your home that you can then quickly, and hopefully it's next to where you keep your mail trash can, like this filing box is just an example of this. And you have 3 or 4 categories. So if it's a bill, it goes in the to pay. If it's a invitation to something, you could have like, I need to deal with this file. If it's something that needs to be responded to, that would go in the I need to deal with pile, a birthday invitation, or a card you'd like to respond to. And so you'd figure out your, hopefully no more than 5 categories, and that mail immediately, so it's basically still in your hand from the mailbox, immediately goes into these files. Another strategy, if it is something that you can deal with immediately, like you're going to just log on and pay that bill right then and there, do it. And then you could potentially even scan that and then throw away the hard copy, which we're going to talk more about later. But the idea here is that you never give it the opportunity to pile up. And it never takes more brain space than that first 5 minutes that you are dealing with it. And the only thing that you have to come back to are the really important things that you've made a choice that you want to deal or that you need to deal with. I recognize bills are not necessarily a I want to deal with it situation. Now, some of that mail that you get is likely going to be either about the medical situation or financial in nature. And I think that is particularly important information to stay on top of. So this is an example of a terrible organizational system. This is what happens when you walk from your mailbox and you put it down on a counter. And then the next day you walk from your mailbox and you put it down on a counter. This is what you end up with. We want to avoid that because looking at this is stressful and a lot, and there could be important things in there that you're missing. So creating that organizational system is incredibly important. I've mentioned the file folder box. Certainly you could use a 3-ring binder if that makes sense with you, electronic files. There are some pre-built planners that are specific to cancer. Most of them have a cost associated with them. What do I think is better? It doesn't matter. One of these is not better than the other. What matters is what is a system that makes sense to you in your life with your brain, and what is the system that you are going to maintain? Because it is not, again, a one-size-fits-all situation. I will say, if you really are interested more about dealing with documents and getting organized around paper, we have 2 webinars archived on our website that are phenomenal. They're offered by a certified professional organizer about dealing with paper specifically, because there's just so much of it. And one of the reasons there's so much of it is that once you've received care, there are going to be multiple pieces of communications that are sent your way. And these could be communications via some sort of electronic portal or email, or they could actually be an envelope you get in the mail. It just sort of depends on the company. So the first piece of communication could be, we've received a claim. The second could be, now we're processing the claim. And the third is something called an explanation of benefits. And this is just an illustration of the types of information you might find on an explanation of benefits. Of course, every insurance company presents the information in a slightly different way, but generally we would hope they have at least this minimum level of information. So there's going to be information about, the telltale sign that this is an EOB is that somewhere on it, it will say in big black letters, this is not a bill. And then there's going to be some information about the policyholder, how much total was billed, and the snapshot of how much you may owe. But then there's going to be some details. So the dates, the service, how much was charged, and how much you're responsible for. I will say, you may not even see words on your EOB. You might just see codes in that first box. So it can be a little bit frustrating to try to figure out, well, what is this EOB actually for? But I will say asking questions is really helpful. Now, keeping track of these EOBs is helpful for a number of reasons, because you could track how much your insurance company thinks you've paid towards your annual deductible or your out-of-pocket maximum if they provide that information on the EOB. It's also going to be really important because this EOB could be where you learn that your insurance company has denied a claim. And then they should also provide some information about what to do with that denial. Now, the last piece of information that you could receive is the bill. And the bill is from the provider themselves. So that could be the hospital, the lab, the imaging center, the surgeon. The challenge, the practical challenge, is that this doesn't always happen in the correct order. Unfortunately, providers are often faster at sending the bill than the insurance companies are at processing the claims. So you could get a bill from your provider, and if you haven't gotten the EOB yet and you pay that bill, it may be a situation where then you're now going to have to work to get the money back from the provider because they've been paid by you and the insurance company. So the general rule of thumb is you should wait until you get the EOB before you ever pay a bill. But it can't happen in a vacuum. It is very important to keep track of this information and to communicate with the providers. So that's as simple as calling up the provider to say, hey, I've gotten the EOB from you, or excuse me, I've gotten the bill from you, but I haven't received my EOB. Could you just make a note in my file or push back the due date? In all the years that I've been doing I've yet to hear that there's a problem with that. But if you don't communicate with the provider and the due date comes and goes, the providers might wonder, am I ever going to get paid by this person? I also think this is a fantastic place where friends and family can step in to help you organize. So if you get that statement that so many people give, let me know if there's anything I can do to help. Yes, you know what you can do to help? you can come and go through my file of medical things, because, I never put anything down on a counter now. It's now filed away in my file box. Go through that file of mail that I got and match the EOBs to the bright bills and staple them together, so that all I have to do is go through that very neat, organized pile and pay the bills. As you pay those bills, I think it is helpful to write on the bill paid with a date. I also think if you're paying in different ways, it's helpful to make note of that. So if you have a flexible spending account, for example, that you're using, to write on that paid by, flexible spending account January 30th, paid by check number 532, paid by Visa ending in this number, so that if there's ever a question later, you can easily go back and see how you paid that bill and then track it down if necessary. Otherwise, it can get a little bit daunting, especially if you've been sent the same bill by a provider more than once. Did I pay this? Did I not pay this? Is this just number 2? And this can happen, I feel like, to everybody. But certainly when someone's in the midst of a serious medical diagnosis and lots of treatment, you could be getting bills from, 10 different sources. And so it's a lot to keep track of. And because we recognize how challenging it is to keep track of, we've created a tool. This is our bill tracker worksheet. And this is available on triagecancer.org. It is a Google Sheets document. You don't have to have a Gmail address to access it, and you can download this to either your drive or your computer, and we've given you instructions on how to do this. Do that here. But what's really unique about this worksheet tracker is that it does some of the work for you, in that when you first set up the worksheet, you're going to put in some information about your health insurance. So the plan name, you're going to put in your deductible amount, whatever that is for your plan, and you're going to put in your out-of-pocket maximum for whatever your plan says it is. Then, as you get bills through the year and as you pay those bills, you're going to start adding that information line by line in the bottom half of this worksheet. And as you add that information in, the worksheet will start to deduct how much you have paid from your deductible. And it tells you how much more you have to pay to meet your deductible. It does the same thing for your out-of-pocket maximum. So I think this is really useful, particularly if you have the type of provider that every time you walk in, they ask you for your copayment. Well, once you've reached your out-of-pocket maximum, maybe you don't have to pay that copayment, but they're waiting for the insurance company to catch up. You're like, I don't know, I've paid tons. Using this tracker helps you know and be able to say, I've already met my out-of-pocket maximum for the year. I don't owe you that copayment. There's also some other helpful things about keeping information all in the same place. So again, you can put here how you paid it. If it was denied, do you need to appeal it? Is it something you need to submit to a flexible spending account or health savings account, or any other notes that you might have about a particular bill? So again, this is available on triagecancer.org to download for your use. Now, keeping track of the EOBs and what you've paid is only a piece of the puzzle here. You also have to make sure you're reviewing any bills for mistakes. The reality is that medical coding is a human process and humans make mistakes. And so it is important to compare those EOBs with the bill, that they match up. If there's maybe something where there's only that code and you're like, I have no idea what this is, asking for clarification to make sure it's something that you did in fact receive is helpful. If you have a really complicated medical claims situation, you might want to consider enlisting the help of a professional bill reviewer. There is an alliance of claims assistance professionals that you can put in your zip code and find somebody near you. Typically, those organizations, if they are able to recoup money for you, will take a percentage of whatever they recoup. And then certainly if you have gotten a claim denial, so your insurance company has said, we are not going to cover that claim, that you appeal that. We think it's really beneficial for people to understand that they don't necessarily have to take no for an answer when the insurance company says it. And that depending on the type of health insurance that you have, you may have 2, 3, or maybe more opportunities to appeal that denial. So we have tons of resources on our website to help guide you through the appeals process substantively. But for today's purpose, the reason I'm bringing it up is because not only does the idea of appealing a denial add to your to-do list, generally speaking, it's another place where you have to remain incredibly organized, because it's likely that you're going to have to have multiple conversations with the insurance company, with your healthcare providers, maybe your employer, depending on where you get your insurance from. So keeping track of all of those conversations, the dates, the times, their names, the summary of the conversation. Is there a due date that you need to do something by, or you were expecting something by a certain due date? All of that needs to get tracked. And so we typically say the Post-it note method of taking notes about this stuff is not a great idea, because inevitably you'll lose that one super important Post-it note. We've created a health insurance appeals tracking form, which is, again, a document that you can download from our website to just help you stay organized in keeping track of all of these conversations. I also think this is a really good time, in addition to your mail, to get friends and family to help out. So someone says, let me know what I can do. Yeah, you know what you can do? Can you sit on the phone with me and take notes while I talk to the insurance company, or while I talk to the provider, just to make sure that, I don't miss anything, or maybe I can just focus on having the conversation and know that you're going to be sort of back up taking notes, or remind me if there's anything that I have missed. In addition to keeping track of all the conversations that you've had and the EOBs and the bills, you're also going to want to make sure you're keeping records of some other details around your healthcare. And certainly that could be any prior authorizations that you've received, but anything that you've paid for related to your care that hasn't been reimbursed by insurance. So those could be either claims that were denied and you didn't win an appeal. It could be costs around having to travel to receive care. You need to keep track of that information. And the reason for that is that some of those expenses could be tax deductible. And we are coming up on tax time in a couple of months, which is why we wanted to spend a little bit of time talking about taxes. Of course, many of us pay both federal and state taxes. And so the state rules vary, obviously, from state to state. But most of us who earn a certain amount of money are required to pay or to file our taxes. And so these are just the dollar figures for this year. If someone is single and under 65, as long as they've made more than $12,950, they're required to pay taxes. Now, two terms that get thrown around a lot when it comes to taxes and are often used interchangeably when they really don't mean the same things are deductions and credits. So when we talk about tax deductions, What that does is it reduces the amount of income that then you get taxed on. So if you've made $100 in the year and you have $10 in deductions, you're only going to be taxed on $90. That is different than a credit. What the credit does is it reduces the amount of taxes that you owe. So if the IRS determines you owe $1,000 in taxes, but you are entitled to a $500 credit, you now only have to pay $500 in taxes. So understanding the difference between deductions and credits is important. When we talk about deductions, there are standard deductions, which is a set sort of dollar deductions that you're going to get. And then there are itemized deductions. Which is going to be better for you is wholly dependent on your situation and the year that you have had. Now, when we look at, well, does someone have to file taxes or not? We're going to look at their income. Well, what's income? It's certainly earned income. So that could be salary or bonuses or unemployment benefits, but it could also be unearned income. So if someone is collecting alimony or rent or interest on a savings account, that is going to be considered income when you're thinking about, have I made enough to file or to be required to file taxes? Now, in addition to a dollar figure requiring you to file taxes, even if you're under that amount, there are certain situations when you're going to need to file your taxes. And I will tell you, this is not an exhaustive list, but these are some of the most common. So many times we hear from individuals who have been diagnosed that they need to pivot their work situation to gig work or consulting, doing something quote unquote on the side. And so that is generally called self-employment. And so if you have earned at least $400 in that self-employment situation, you're going to need to file taxes, even if you're under that $12,900 mark. There are also some other examples. If you work for a church, it's a pretty low dollar figure. But if you've received premium tax credits through the state health insurance marketplaces, otherwise known as Obamacare's insurance marketplaces, if you've gotten that financial assistance, you are required to file your taxes, even if you are under all of the income thresholds. So just keep that in mind. Now, let's say you haven't earned more than $13,000 and none of these situations apply to you. Is there still a benefit in filing your taxes? And the answer is maybe. So there are a couple of reasons why you might want to file your taxes, even if none of those other circumstances apply. And these are just some examples. So it may be that you've prepaid tax payments that you could get back. You could be eligible for a number of credits, like the earned income tax or the child tax credit, or you could file your taxes to ensure that you could get that premium tax credit for your health insurance for the year ahead. So it is, again, not an easy decision to, yes or no if you've made under that 12,900 mark, but keep in mind that there might be some significant benefits to filing those taxes. Now, I did mention that keeping track of things that you have paid for your medical care that haven't been reimbursed is helpful for your taxes. And that's because you could deduct qualified unreimbursed medical expenses, provided that the total of those expenses is more than 7.5% of your adjusted gross income. So it is going to depend on how much you've made and how much you've spent on these medical expenses to determine whether or not you qualify for this deduction. And if you do qualify for this deduction, you are going to have to itemize your deduction. So you don't get to use that standardized deduction. You have to itemize. And also keep in mind that you can't double dip. So if you have used your flexible spending account or a healthcare savings account to pay those unreimbursed medical expenses, you don't also get to deduct it on your taxes. And the reason for that is the money in FSAs and HSAs is already a tax advantage. So you don't get to have two tax advantages on the same funds. So we want to keep track of those expenses. Keep in mind that tax day is April 15th. We now have the option to e-file, but remember, you have to have that email address to do that. Of course, you can still mail in your tax forms as well. There are a number of ways to file taxes that do not involve an accountant or a tax lawyer. There are several tax prep services. I think H&R Block is one of the most well-known, but it is certainly not the only one out there. Believe it or not, I know some people who go to the IRS website and download forms and completely DIY it. And there's nothing wrong with doing that if you have that capacity. There's software that you can use, but sometimes you need help. So I don't know if I fall into this situation, or I don't know if I qualify for this, or, tons of questions come up around this. So there is a taxpayer advocate service that could be very helpful. There's also something called volunteer income tax assistance, and you can find someone near you to provide free tax prep on the irs.gov website. And so for someone who cannot afford to hire a tax lawyer or an accountant, or even pay the tax prep services, that volunteer income tax assistance program could be incredibly useful. Now, regardless of how you file your taxes, you do want to make sure you keep records of the fact that you filed your taxes and records of anything related to deductions you've taken. And the general rule of thumb is that you keep that information for a minimum of 3 years. And that's because you could be audited by the IRS. And if you are audited, you're going to need that supporting evidence as to why you were eligible for any deductions or credits. So that begs the question. Here we are talking about dealing with paper and clutter and organizing. And now I'm telling you, you have to keep receipts for 3 years or longer. What do we actually do with all the paper? This is where a filing system comes into play and can be really useful. And I think that, again, this is going to be not a one size fits all situation. And so there's absolutely nothing wrong with hard copies. File folders, you're going to label the file folder, you're going to put it in a box or a filing drawer. But here's the thing. If you choose this hard copy file situation, I envision it something like this. It is important that you set aside time to periodically clean out these files. So I happen to do this the week after Christmas. It makes sense in my brain. Before I start the new year, I'm going to clean out the old stuff that I don't need anymore. But what about those 3 years? You have to keep files, right? You keep them in a drawer for 3 years next to you? Maybe, maybe not. I also think that thinking about things in terms of archives could be helpful. So you could have a box, that is just your taxes. And again, every 3 years you're going to go, or every year you're going to go in and you're going to put the new stuff in and take the old stuff out. it's still going to be a lot of physical paper that you have. So an alternative could be to digitize. Now, that could include a physical scanner. I was curious about how much scanners actually cost these days, and there is, perhaps unsurprisingly, a very wide range. This one on top, the tall or the long skinny one was $50. The one below was closer to $300. So there really is a range when it comes to scanning, but it is much more accessible than it once was. But even most of us don't want an extra machine in our house, or maybe we can't even afford that. So there are a whole category of apps that you can use your mobile device, whether that's a phone or a tablet, to effectively scan your documents. And what you do is you take a picture of the document and the app converts it into a PDF savable document. Two examples of this, again, just examples, JotNote and Adobe Scan are both free apps that you can download to both Apple and Android devices. They're incredibly useful. We use them at Triage Cancer on a regular basis. Okay, so you've taken a picture or you've scanned something. Now what do you do with it? One option would be to save it to the cloud. And so all of these scanners and apps can be connected to your cloud service of choice, so Google Drive or iCloud or Dropbox. But there's a lot of people who don't feel comfortable putting that kind of information on the cloud and really don't, what is the cloud anyway? So some people choose to save it to a physical device like a computer, which is completely fine. There are pros and cons to both things. Certainly, if you save it just to a computer, there's challenges if you get a new computer or if your computer crashes. You may only have so much space on a hard drive in your computer. But conversely, it is going to be a little bit more protected than perhaps the cloud. So let's talk about the computer. Just like everywhere else, someone's computer is a place that can manifest clutter. And a way to avoid that is to use folders. And this is just an example of what I mean when I use folders. Here I've categorized the main things that I'm going to keep on my computer: bills, photos, taxes. But within each of those categories, we're gonna do a deeper dive. So it's not just every bill, it's bills related to my home or my medical care or my student loans. And then within each of those folders, we're gonna have additional information. And so here I have scans of EOBs and bills together for different appointments with the dates. I also have that appeals tracking form because the dermatologist was denied and I had to appeal it. So that tracking form is right there in my medical bills folder. I've also saved my medical bills tracker, that spreadsheet, in the same folder. So here I can go to one place and get all the information. But there's a way I can make this even better and even more organized. And that would be to include perhaps the year of medical bills that I'm referring to. So then come next year, I can create a new folder for 2023 or 2024 and only have the information related to that year in that folder. So that really is the benefit, I think, of the electronic files, is that you can further separate information, making it easier to find what you need should you need it in the future. So we've talked a little bit about medical bills, but what about other bills? How can we get more organized around other bills? I think the name of the game here is streamline and simplify. And there's, again, lots of different ways that you can do that. So setting up automatic bill pay so that you don't even have to think about it. If your phone bill is $60 every month, that just automatically gets paid out of your checking account. Sometimes, though, it's a little bit daunting because you might not know how much a bill is going to be. And if you can pay it because you haven't gotten your paycheck yet. So in those kinds of situations, when you don't just want it to be automatic, I still suggest using banks' online bill pay systems. So most banks now have an opportunity where you can pay bills directly from your bank account. And the real benefit, in addition to saving paper and stamps and all of that, is that it creates a record for you. Shoot, I can't remember if I paid the water bill or not. Things were so crazy. Okay, well, I can just log onto my bank system, look at my account transactions, and see whether or not that water bill has been paid. I also think this is where spreadsheets can be really helpful. If you haven't figured out, I am a spreadsheet fan. And so it could be a checklist where you've listed all of your bills, and then every single month, and you just check them off as you pay for it. It could be some sort of spreadsheet or tracking. If you Google bill spreadsheet or bill tracker, there are probably hundreds of thousands of free downloadable examples that you can find. You could certainly create one yourself. But the idea here is that for you, it makes it easier to look down a column, like, are there any blank squares that I missed? It's also really helpful if someone is stepping in to help you. So if one of the things that you need help with is this financial aspect and the bill paying aspect, being able to hand over a spreadsheet to, a friend or a sibling and saying, like, these are all my bills, this is what needs to get paid, make sure nothing gets left behind. For people who are really struggling, they may want to consider appointing a financial power of attorney, which is an estate planning tool where you're giving someone the authority to make financial decisions on your behalf, like bill paying. And it is only one of many estate planning tools that could be useful for everyone. There is sometimes a misconception that estate planning is only useful for older individuals or individuals at end of life, when in reality, it's about planning. It's about planning for the unknowns. So at Triage Cancer, we have tons of resources to help people with their estate planning, all of which can be found on our estate planning hub. But before you go into any sort of actual estate planning, there's some foundational steps you have to take. And that includes figuring out what your property is. So you have to know what your real property, like houses or cars, your real property like homes, or your personal property like cars or family heirlooms. You have to understand what your non-physical property is, like bank accounts and retirement accounts. So all of this takes certain organization to understand what it is that you own. It's also helpful for estate planning to understand what it's worth. And so it could be that you need to have an appraisal done to get a dollar figure of what something is worth. But then, of course, those appraisals need to be kept somewhere. Now, I'd also be remiss if I didn't make the point that you may have property that has value that is non-monetary, so the sentimental value. And if you have property that has sentimental value to you that you want to pass down in your estate plan, it could be helpful to document the why. So why is that property valuable to you or your family? What's the story behind it? Who did it belong to? What year is it from? And keeping that documentation with any estate plan that you create can help ensure that your family knows the value and maybe even doesn't inadvertently get rid of something. And so this is all stuff that has to be kept and organized in a way that makes sense, not only for you, but for others. There's some other pieces that people don't always think about around property. And so if you have a safety deposit box or a storage unit or bank accounts, all of that needs to be documented somewhere and in an organized fashion. And since I've now told you all that you should have email addresses, that's another piece of property that you have to take into consideration. And so email and social media could house things like cloud accounts and photos and important documents and files. And so depending on the platform that you use, there are different ways to protect that information and make sure that it gets passed to the people that need it. Another piece of getting organized around your overall health and your estate plan is around insurance. So understanding and compiling an inventory of all the different types of insurance coverage you have and who the companies are and what type of coverage and how much coverage, how much does it cost is valuable. Certainly I'm talking about things like health insurance and disability insurance, but also homeowners and life insurance and all the other types of policies that we buy that maybe others don't know that we have. So all of these things that I'm talking about, so estate planning documents, the physical deeds, the information around your taxes, passwords, keys. The financial situation is about more than just numbers. So there may actually be these documents that you have to keep track of. So sure, you could file folder them, absolutely, nothing wrong with that. But there's also some dangers. So if that's the only copy and there's a fire, that could be a challenge, or a flood even, right? So what are some backups that you might be able to use? Certainly when we're talking about things like advanced healthcare directives and a will, it's helpful for the people involved to know where those documents are. So either photocopies or sometimes I recommend that someone, if they have a Google Drive, they save those documents into the drive and then they just give access to all the people that need to be there. So the guardians of minor children, the executors, any sort of agents. I fully recognize there are some people who feel like that is not secure enough. And so there are some paid services that have extra levels of encryption and security. Master Lock Vault is just one example of that. Part of getting organized isn't easy. Much of organizing isn't easy. When we talk about cancer and financial health, getting organized around money and debt's a big piece of that puzzle. And so we have something we call our financial big picture document. Again, it is a downloadable spreadsheet. What is useful about this spreadsheet is that it prompts people to look through those drawers, those filing cabinets, and pull out all the information. So, what are your assets? The cars, the wedding rings, the savings accounts, are there retirement accounts? Sometimes people have more than one retirement account because they've moved jobs and they haven't rolled over. Putting all of that information in one place can be incredibly useful, A, to know what you have, but B, as an estate planning tool as well. So if you have someone coming in to help you with your finances, making sure that they understand the overall picture is useful. Now, money is a place where many people feel out of control and like they need to regain some control. And so reassessing a current situation can be helpful. And these are just some big picture questions that someone can start with. It's also helpful to know if they have predictable income and assets. And certainly that piece of the puzzle is going to be easy if they've completed that financial big picture document. But what do you do with that information once you have it? You complete the financial big picture document and you recognize, I'm not in a place where I want to be. One thing that you could do is create a budget. And I think that there are lots of things that I say on a daily basis that are easier said than done, and this is certainly one of them. So creating a budget can be really challenging and daunting. I think there are three main steps to it. The first is you've got to pick a method. What method makes the most sense to you? If you are a file folder kind of person, maybe a cash envelope system works best for you, or a pen and paper works best for you. If you're a super tech person and always have your phone in your hand, maybe an app works better for you. Then you have to identify all of your income, which hopefully should be easy if you've taken all the steps up until this point. And then you have to look at your expenses. These are 6 categories that I think most of us have, where we have to think about expenses. And I think the key here is that when you're identifying these expenses, you have to be realistic. Many people try to be the best versions of themselves when creating a budget on paper, and that's not really going to be helpful. So what are you actually wanting to spend money on? And it might turn out that you look at that on paper and think, oh, well, I can't do that anymore. I need to cut back and only have 2 streaming services because I'm not bringing in enough income. But this creating a budget is incredibly valuable, both for financial health, but also that emotional stress piece around staying organized. Now, I mentioned apps because I think they can be really useful, but I think the key to using an app is to think about what the overall goals are. So if ultimately someone wants to make sure that they're budgeting and they're not spending too much money, there are certain apps that are better for that. If somebody rather is trying to figure out, well, how do I pay off debt? There's apps for that. Some people are trying to increase their savings. And so before picking an app and going in, feet first, knowing what the ultimate overarching goal is can be helpful. But even with all the tools and all the apps and all the things you can download, it's still a lot. And so if someone needs additional help creating a budget, I would definitely recommend a consumer credit counseling agency or a financial planner. And these are just 2 sources of where someone can go to get that help. Now, another place where we tend to see people struggle with organization is in their homes. And I think that is evidenced by the number of home organization shows and books and magazines and how big the bin aisle is in Target and Walmart. People strive to be more organized. And certainly when I look at these pictures, I can see why. Which environment seems more calm and conducive to improving one's health? The one on the left is a little bit chaotic, if not potentially unsanitary, unclear. Whereas the one on the right is, calm and organized, and it's very not stressful. And so when we talk about getting organized, of course, there are tons of resources out there. But I think too, if someone is decluttering, there is an added benefit, not just the stress level, but potentially it could be a source of income. So when people come to us and talk about needing financial assistance and they haven't been able to find any for whatever reason, sometimes they're able to sort of look within and find sources of income they didn't always think about. And I think this is not even an exhaustive list of all the things to think about. But if someone's hanging onto their wedding dress, and they've maybe been divorced, maybe they can sell the wedding dress, or old furniture, or old musical instruments, or books, or baby gear. And there's lots of different ways to actually sell things now, many of which are much safer than some of the older systems. Certainly, too, a good old-fashioned garage sale can be a source of income, and at the same time, declutter and help organize somebody's physical space. Now, it's hard to talk about financial health without also talking about work, because it's a reality that many people who are diagnosed with cancer have to continue working during their treatment. And certainly we know that up to 94% of survivors either continue working or return to work, and they may be experiencing late or long-term side effects. And so for those people who are trying to figure out how to get organized in their workplace, certainly there are some federal and state laws we might point people to but they also want to look to any employer policies. And so understanding what types of policies and benefits an employer provides is a piece of getting organized at work. Another piece of the puzzle is something called a reasonable accommodation. And these are tools that are provided to certain individuals with disabilities to help at work. And so reasonable accommodations fall into three main buckets, but as you can see here, they cover a lot of different situations. So it could be about a change in schedule or using technology or telecommuting or moving offices. But the reason I wanted to talk about reasonable accommodations today is that when someone goes to ask for reasonable accommodation, there are some practical considerations. And this is the place where staying organized is going to be important. Once someone has decided they're going to ask for a reasonable accommodation, keeping track of who they spoke to, what was agreed upon, then keeping track or a journal of using the accommodations. Is it helpful? Is it working? Are you still experiencing challenges? Because when we talk about reasonable accommodations, it's an area where it's, again, very flexible. So someone could have multiple reasonable accommodations. So at first they think a change in schedule is going to be the thing that's helpful, but after they have that schedule for a month and been journaling, they're realizing, well, not only do they need a change in schedule, but they also need a piece of technology. And sometimes that can be hard to determine if you aren't keeping track of what's going on day to day. In addition to reasonable accommodations, which are a legal tool that can be helpful at work, there are some practical strategies that you can use to address side effects. And so it is important to work with a healthcare team because there could be medication or other types of therapies that can help deal with a side effect. And then a lot of these practical tips we've talked about so far in staying organized in other ways are going to also be useful in dealing with side effects at work. Speaking of practical tips, there are some things that come up that you may need to adjust or implement as you move forward in your day-to-day to stay organized, because the reality is life continues even after a cancer diagnosis. You need to eat, run errands, do yard work, shovel snow, and there are tools that can be useful that exist for you to tap in and get that help. Another thing that we hear sometimes is that any loved ones or caregivers aren't physically nearby. So how can they help? They can't bring me a meal. But thanks to technology, we do have some options for people to help remotely. So grocery delivery is something done online. It doesn't matter if you're in California, you can deliver to someone in Illinois. Meal planners. There are things that can be done remotely if that need is there. Another common concern is around childcare. So whether that's, needing a babysitter or help getting a child to and from school or extracurricular activities, with a cancer diagnosis and appointments, that gets even harder than it normally is. There are a couple of professional services that are out there that aren't, I don't think, very well known. Like Sitter City and Mommy that connect people for shared childcare. Certainly looking local. So are there local students that you can pay? There's tons of Facebook groups for nannies out there. There is a tool that is sort of like Uber, but for carpooling. Maybe thinking about neighbors. So is there somebody on your block that doesn't work that maybe is willing to sit with a child for a while, or your faith groups at churches or book clubs? The idea here is to look outside of traditional sources of childcare. And speaking of enlisting help, when you enlist help, it can be easier said than done. And in fact, in order to be effectively helped, you might need to do some things on your end. And I think centralizing information can be critical when you have multiple people involved in the day-to-day aspects. So maybe it's about a caregiver helping you with your medical needs, like getting to an appointment. It could be the carpool or maybe even just helping your kids become more independent. It takes a lot of energy, both physical and mental, to keep the people that love you up to date with what's going on. So I think technology could be helpful here. When I talk about a command station, it could be whiteboard, a clipboard, a piece of paper taped to a wall. There are certainly new electronic fancy systems like Alexa or iHome or this DAC board, which is pretty cool, but it costs a couple $100. It doesn't have to be complicated, but it is one place where the information is going to live. The shared calendars can be super helpful. So, instead of someone having to text you to say, hey, when's your next appointment? They can just look at the shared calendar. It also helps keep everybody on the same page. I also think if you have a smartphone, considering using a group text message thread so that instead of having to send a million text messages or, calling a bunch of people, it's one message out. Does she need anything? Yes. We need groceries. Great. I can drop them off anytime after work. Fantastic. We'll be home after 5. Instead of sending and having multiple conversations. With group text messages, I think you can have up to 25 people. So that's a lot of people that you can either enlist help or just keep updated in a pretty simple way. Another area that can take a lot of brain power is making sure that you have what you need when you need it, especially if you're in and out of the house at doctor's appointments or running all over the place. And so a suggestion is to keep a go bag. This term comes from the military, where they are trained to always have their packs ready to go. But I really think go bags are helpful for us mere mortals too. So what might you keep in a go bag? Totally depends. These are just some examples. So maybe you're going to keep copies of your insurance card, a notepad. If you're wearing masks in your facility, snacks, water bottles, spare medicine, phone charger. Really, it's anything that you think you might need, and it lives in that bag always. So it's like having a second set of things so that when you walk out of the door to go to the hospital, you need your keys and you need your wallet and your go bag, and that's it. It could also be helpful to have duplicates in a car, for example. Now, go bags don't have to be fancy, a backpack, a reusable shopping bag, it doesn't matter. The idea is that you are only using the brain power once to pack the bag, and then it is always there ready for you. Now, some other things around technology that are useful is emergency contacts in your phone. You can put people, you can put any medical needs or medications that you're having. These are both available on iPhones and Android devices. There's also some, analog ways to do this. So bracelets, watches, but the idea is that if you're ever in emergency and you're unable to communicate this information, how do first responders access it? When we're talking about medical information in a day-to-day setting, there are, again, ways that technology can be useful. So keeping one file folder in your email for everything related to your medical care, having a list of medications in your email with all the dosages and vitamins you take, because inevitably you're going to be sitting in a doctor's office and asked to put that on a form, and it's hard to remember all that sometimes. You could also take pictures of your insurance cards or use the calendar setting to, as you're thinking of questions for your provider between appointments, you can go ahead and put those questions into the calendar so that when you're sitting in the room with the provider, all those questions are in one place. You may also have tools with your smart devices to automatically track some information, but again, this does not all have to be digital and high tech. There are lots of symptom tractors and medical journals out there that just require a pen and paper. Now, I realize that I've been talking for almost 90 minutes and it's a lot and it can feel a little bit overwhelming, but I think like most things in life, being successful at staying organized is a thing that is a work in progress always. And you might not get all of this done each year, but I think, you know, being here obviously is a step in the right direction. But I think in terms of next steps, what can you do today, this week? The first step is to think about your sources of clutter. And I don't just mean physical paper clutter. I mean, where are the places in your life where you are feeling out of control and disorganized? Write those things down. Then one at a time for each source of clutter, what are the systems that make sense to you? File folder here, digital here. It doesn't, again, matter. It's about what makes sense for you. And then what are the tools that you need for that system? Do you need to sign up for an email address? Do you need to buy a file folder system or a scanner? Then I generally recommend that you implement one system at a time. So if your challenge is mail, implement your never put it down system first. Don't worry about anything else, anywhere else you have clutter, just work on that. I'd also say that when it comes to organizing, it's helpful to remember that sometimes it gets worse before it gets better. And I think that's particularly true when you are starting from a disorganized place, that sometimes it has to get even more disorganized. I always think about closet organization. In order to effectively organize a closet, everything has to come out. The room looks horrendous, but then as you start weeding and putting things back in, it gets better. I also think enlisting help in whatever way that means to you is important. And then finally, with organization, I think it's important to be willing to pivot. You might be sitting here thinking, oh, that never put it down system sounds great, but then you do it for a week and it does not work for you. Pivot to another type of system, but don't give up on the attempt to get organized. So with that, I am going to hop into the chat or the questions. So there's a question about, do you need to claim cancer grants on your taxes? And it depends. So it depends because not all grants are grants. Sometimes they're provided in different ways. And so if someone has received financial assistance, it might be worth reaching out to the Volunteer Tax Assistance Program to get more clarification on if they need to put that for their taxes. Would taxi fare to and from the hospital be considered a tax-deductible expense? Likely, yes, it would be. That's that unreimbursed expense related to medical care. And if those expenses exceed that 7.5% of your adjusted gross income, it could be tax-deductible. If you've used all your funds in the FSA, but then you pay on top of that an additional 7.5% of your adjusted gross income, would you get the unreimbursed expenses? Yes. So for anything that you paid for not using your FSA, that qualifies for those unreimbursed expenses. Any concerns with identity fraud when disposing mail by trash or recycling with confidential information like account numbers? Yes, there is always a concern of that. And I think that that is a great point that we will add to future presentations. So how do you deal with that? I think there's lots of different ways. Certainly a paper shredder could be invaluable there. There are stamps and rollers that you can use that are quite inexpensive to cover up any confidential information. I know in my area, there are periodic community shredding events where you can take a box of documents to like a truck out in a community and they will shred it for free. So if someone's really concerned about that, maybe instead of the recycling bin, they have a second bin that's going to get taken to a shredder somewhere. So definitely you want to be careful of that, because there is a lot of identity theft and fraud issues out there. So I often feel like I need to keep everything, some mental health issues in addition to cancer. How do I let go of things that I don't need? I'm getting overwhelmed physically and mentally. And I appreciate the question, and I think it's a real thing. I don't think there'd be so many organizational shows and books and things out there if people didn't struggle with this, even without the added challenges of illnesses. I think getting help, right? So whether that's a friend to sit down next to you and really push you, do you need this? Yes or no? I also think that if it's around documents, maybe starting with an electronic system is step one for you. So you're not really getting rid of things, you're just getting rid of the paper version of that thing. I will also say that if you are in the position, there are professional organizers that you can hire that can come in and provide that assistance, because it is hard to do. I fully recognize that. Okay, so I'm sorry I didn't get to all of the questions, but certainly I will remind you that this is not your last opportunity to learn from Triage Cancer. So we have a number of educational events coming up, including our Triage Cancer conferences that are open to anyone who would like to attend. They will both be virtual this year. The first will be on May 20th. Registration is open for that, so we welcome you to register, and please do spread the word to your communities. And then we have a training that is specific for healthcare professionals called our Insurance and Finance Intensive. And this is where we do a deep dive into all things health insurance and disability insurance and employment. They're free to attend, and we do provide free CEs. And we have our dates open for 2023, all of which are can be found on our website. And then finally, especially for the people who we didn't get to answer all the questions for today, I want to remind you about our legal and financial navigation program. So you certainly can fill out this form on behalf of yourself, or if you are a caregiver or a healthcare professional, on behalf of another. And then I hope that you will continue to stay connected with Triage Cancer. We have, I think, at least 10 more webinars this year. We are frequently posting on social media about late breaking news and updated information. We have our educational blog that you can subscribe to by holding your phone over the QR code. And then if you are either a healthcare professional or in a position where you are disseminating information to your communities, like you run a support group, for example, we do send bulk hard copies of our materials. All you have to do is go to this material request form, let us know how many of each material you would like us to mail, and we will send them out to you. So again, I really hope this is not your last interaction with Triage Cancer. And just a quick reminder that in order to get CEs, you will have to complete the evaluation and the post-test that will arrive in your inbox within 24 hours from Zoom. The post-test is at the end of the evaluation, so just click next and you'll get to the post-test. And if you do all of these things, then you will get your certificate within 4 weeks. If you are a nurse or a social worker and you want CEs, you do need to receive a passing grade on the post-test. If you take the post-test and you see this screen, congratulations, you've passed, nothing else for you to do. If, however, you see a message like this, it means that you did not pass the post-test, but you do have the opportunity to retake it. And if you go to triagecancer.org/post-test, find this event in the list, and then there will be a link to just retake the post-test. You do not have to complete the whole evaluation again. So thank you so much. I'm sorry we went over a couple of minutes, but really appreciate your engagement and joining us today. I hope you have a great rest of the day, and we'll see you back again soon. Bye.